I will take you to DAMP Siviwe Gwarube, who's just completed an oversight visit to the Eastern Cape. In fact, I'm told we can go there now. Are we able to bring back Siviwe and speak about her oversight visit to the Eastern Cape? Well, we can, because the Premier Oscar Mabuyane is appealing to President Cyril Ramaphosa for help to fight COVID-19. More than 800 healthcare workers in the Eastern Cape have tested positive for the virus. Over 150 schools have recorded positive cases. The Eastern Cape also has a shortage of beds, and nurses in the province have protested over the lack of protective gear. The DA Shadow Minister for Health is Siviwe Gwarube. She's been visiting those hotspots, as I was saying. She joins us now from Cape Town by Skype. Siviwe, very good afternoon to you. Thank you for being on ENCA. I was touching on the issue of a shortage of ICU bed space, and you experienced that firsthand, or at least got a first-hand account as far as Cecilia Mabuyane Hospital is concerned.
Yes, good evening, Tembegile. Yes, on Monday I undertook to start a two-day oversight visit in the Eastern Cape. I visited first Cecilia Mabuyane, which is obviously in the hotspots of Buffalo City Municipality. And upon arriving there, it is quite evident that we have in this country very dedicated healthcare workers who are willing to really serve on the front lines, but are simply asking for the bare minimum in order for them to be able to wage a decent fight against this virus. Cecilia Mabuyane, as an example, has only 2 ICU beds for COVID-19 patients. And the area that they have identified for additional beds is still being renovated as we speak. And the numbers are climbing daily. In fact, on that very day, when we visited Cecilia Mabuyane, there was a case of COVID-19 tests which were found on the side of the N2, which the Premier and his government are yet to shed some light on. And so all of these issues around staff shortages, the 20 nurses at ICU in Cecilia Mabuyane, the lack of ICU beds, in our view, it points to a health system that is not equipped to deal with the curve that is besetting the Eastern Cape. And it is our view that it is rather important that the Minister of Health undertakes to have interventions in this province sooner rather than later.
So at that briefing yesterday by the Eastern Cape government, one of the things that came up was the desperate need for ICU beds, about 3,000 of them needed by September. Based on what you saw on this visit, do you think that the provincial government will be able to meet that crucial target?
It is difficult to imagine that they would, Tembegile, because, you know, when we spoke to the CEO at Cecilia Mabuyane and the CEO at Fort England Psychiatry Hospital in Grahamstown, both told of stories where they have effectively written to the provincial government to state how many healthcare workers they are down as more and more healthcare workers are becoming ill. And these requests have essentially been pending with the provincial government for weeks. The Cecilia Mabuyane ICU is down 20 nurses, and they're operating with 15 where they're meant to be having 35 nurses. So it's very difficult for me to think that, in fact, the provincial government will be able to pull those beds together unless there is national intervention, which for me, you know, there are provinces that are not experiencing the curve the way that the Eastern Cape is. And even if you look at Gauteng, that is experiencing rising numbers, but we do know that capacity in Gauteng is very different from capacity in the Eastern Cape. And so if we are to really prevent loss of lives in this province, then we're going to have to intervene, and we're going to intervene in a holistic manner and provide staffing and provide ICU beds and provide things as simple as oxygen. In the Eastern Cape, there is a trend that is going around where hospitals are running out of basic oxygen, not even ventilators. And so really the crisis there is looming. I don't think that the Eastern Cape has until September to fill those beds. I think that the curve is exponentially increasing now. And the intervention is definitely needed now.
Let me ask you then, because the complication with the Eastern Cape is that much of the problems, be it in healthcare, education, infrastructure development, have gone on for the better part of 2 decades. Do you think that this COVID-19 crisis will be what finally forces action in the right direction, even beyond COVID-19's response?
I truly hope so, Thembekile, because you, as you would know, the Eastern Cape Provincial Department of Health and its Education Department, which are now at the coalface of dealing with this crisis, have been under administration according to Section 100 before. And they've fallen back to the habits that they have now found themselves in. And as somebody said, that the COVID-19 crisis is not an opportunity for our government to show how well they react to a crisis. But in fact, what it has done is to show us that systematically over the years there has been mismanagement, sheer corruption, which has robbed our system of being able to be ready for crises like this. Of course, we've seen across the world that countries have battled to cope with the sheer numbers. But here we have a situation where this is a province that was already on its knees, and it's unlikely without rampant intervention that we're going to see it being able to cope with any of the demands that are going to be on it.
Siviwe Gwarube from the Democratic Alliance, thank you for your time this afternoon.